Dear students, we'll discuss a topic in the foot. Not uncommon, remember. Just have a look what this condition is. See that? Here you can see that left side great toe is like this. Whereas here you see that it is going like this, deviated. So that it is a valgus deformity, going outward. Anywhere, knee joint also go outward like this. So valgus deformity of at the first tarso-metatarsal joint right side. If it is inside, it is a varus deformity, VARUS. It's a valgus deformity. Valgus is common. So right side valgus deformity in the great toe at the right tarso, first tarso-metatarsal joint. It's the normal one, remember. So this is Hallux Valgus deformity. Great toe deviates laterally at the first metatarsophalangeal joint with the medial deviation of the first metatarsal head. So head comes this side, toe goes this side. Head comes this side, toe goes opposite side. So in opposite direction, you can see the prominent head here. You can see prominent head here. So it's very typical. So features are often bilateral, common in females. Bursa, it is called a bunion. What is bunion? Bursa occurs in this area. Often MCQ question. It's usually seen in Hallux valgus over the head of the first metatarsal or over the any heads of the metatarsal bones it can happen, but it's very common here. Bunion is very typical, seen in the head of the first metatarsal bone, especially in there is Hallux valgus. It's a bursa. May be present medially. Osteoarthritis, first metatarsal joint can occur, and people may be pain, tenderness, thickening of the skin can occur because difficulty in walking. Patient feels that there is some problem. This bone is there is a crowding of the toes actually. Toes will go like this. And X-ray show deviation and osteoarthritis. Now treatment is typical orthopedic treatment, even though it is, I'm discussing here, it's a typical orthopedic but very common entity. That's why you have to know. Orthodesis, bunion excision, correction of deformity by different osteotomy and sometimes muscle interposition. You can do orthodesis, pain is relieved, or osteotomy, muscle interposition, correction of deformity. So the different treatment, different names are there for MCQ purpose. Keller's, Mayo, Siemens, remember. It is the Keller's operation is used. There are so many few other Keller's operations also there in orthopedic, I think. But typical Keller's operation is for Hallux valgus. So answer the MCQ. The ram's horn nail is onychomycosis, onychogryphosis, onychocryptosis, onychomycosis. So students, put the right answer in the comment box. I'll get back to you. So students, go through my SRB's clinical methods in surgery, which has got a video lectures of each topic. So many topics are covered. Every topic as far as CBM syllabus is covered. How to examine the patient. Swelling, ulcer, arterial disease, venous disease, thyroid, breast lump, mass abdomen, briefly orthopedic, every system, whatever your required thing, everything is covered. There is a video of how to examine of each topic and principles of examination is good, and differential diagnosis in the table format is given, and briefly investigation. Suppose treatment is not a topic will be covered in a clinical method examination, remember. And many photos of the most of the conditions with the illustration. Photos will tell the clear idea about for the students how exactly condition looks like. So covers everything with the beautiful photos, and it also gives the instruments, specimens, then operative surgery briefly. Everything is covered. Small images also it is covered. So it is more than sufficient for all undergraduate, postgraduates of any system to learn. Very basic required thing for the surgical field is clinical methods. So please go through that and purchase that and make use of it. My SRB manual of surgery is very popular. It covers a theoretical aspect, everything, principles, treatment in detail, briefly technical aspect, and with the photos, illustrations, quotations, all topics with the specialty, urology, cardiothoracic, neurosurgery, and operative surgery instruments. Again, it is covered in this book also. Every quotations, and you should worldwide also, actually including our country, everywhere. And please, you can make use of it. My operative surgery book, SRB's operative surgery atlas, that is a 2-volume book, covers in detail operative technique of surgery, all surgery, small surgery, major surgery, everything, with around total around more than 10,000 illustrations and photos. It gives very good principles and technical, step-by-step technical aspect. Very, very useful for postgraduates. Not much useful for undergraduate, but it's a postgraduate book and consultant book and learner after MS. It gives everything. You can, before going to surgery, you can always read this book and have memorize your steps and do the surgery properly. Every topic, general surgery, gastroenterology is covered in detail, step by step with illustrations. And my SRB is Atlas of Tissue Approximation, small book atlas, 100 pages, how to do the suturing, tissue approximation, including laparoscope suturing with the video. It is covered. So any basic learners, suturing is very, very important surgical field as a skill actually. Dissection and suturing, so the two parts of the surgical skill. So that is also covered very well with videos. You can always go through that. And my website, please subscribe, all of you. If your daily lectures are there, live sessions are there. My Digihour lecture through JP Publishers, around 220-hour lectures. Entire thing as for CBM is covered with the examination part, with all topics of CBME, ulcer to operative surgery, instruments, specimens, examination, specialties, basic, everything is covered. You can always purchase for 1 year and have a clear idea about the surgical topics, understand very well and helpful for your exam, NEET, MCQs. Also, it is there both in manual and my lectures. So students, I hope you have understood this lecture very well. Thank you very much.